to reduce the clutter on your table, you need a direction. So something like PrepLadder gives us that direction. You have some 40 hours or 50 hours of gynecology.
I have given all the content of pharmacology.
I've contributed the entire content for internal medicine.
I have created the content for PSM.
You can trust the questions and explanations to be genuine.
Detailed explanations will help you solve the different variations of the same question.
Textbook references will help you authenticate an answer.
I have created this content after close inspection of the previous year questions.
I have put in my 14 years of experience into creating these questions.
Includes the latest exam questions, questions on the recent updates, as well as image-based questions.
All questions are according to recent exam trends and difficulty level.
So the software would be exactly like the real exam.
All your queries come directly to me. So if you have any kind of doubt, you can ask me directly.
I'll be solving all your microbiology related queries.
You can ask anything about the subject, doesn't have to be only about a question.
I'm always available for you whenever you need help.
You can have a counseling session with me.
So we've put in features to make sure you keep studying. The PrepLadder app will never let you fall behind.
Solving obs and gynae questions will be easy for you after this.
You would not have to worry about anatomy at all.
You will be able to solve most of the questions in PSM.
Most pathology questions in the exams are going to be derivatives or the repeats from these questions.
1 lakh competitors.
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 It's good to see that everyone in the team is giving their best.
This is the best team of faculties that could have been put together.
This is the biggest innovation in medical education.
We are obsessed with making sure that you get the best value out of every minute spent on the PrepLadder app.
Really happy to be a part of Team PrepLadder.
You know, if there was something like PrepLadder when I was preparing, I'm sure that I would have prepared much better because I would have known what to read.
So what about the ectoderm? I'm taking a transverse section just like we have seen here and draw a diagram. As you draw this diagram, you'll find that we have already discussed about a primitive streak forming the 3 germ layer. That could be ectoderm or mesoderm, endoderm. So where does it appear? It appears toward the caudal end and moves toward the cephalic end. Actually, towards the cephalic end, there will be a plate formed which is called procaudal plate, which is also the region of buccopharyngeal membranes, anteriorly or cephalic region. And if you're talking about the caudal region, there is the cloacal membrane or the anal membrane. We want to draw this diagram now. So what are we drawing? Actually, it is the dorsal view of the embryo. And what we see in the dorsal view of embryo? Lot of epiblast. Now, if you say these are lot of epiblast which are present on the dorsal view of the embryo, what they were doing? They were forming primitive streak. And where the primitive streak appears? It is towards the caudal end. So this is the primitive streak, and as you are telling that primitive streak will appear towards the caudal end. Where is it migrating towards? Actually, it was migrating towards the cephalic end. So you can show now that this is the cephalic end of the baby, and this primitive streak is migrating towards the cephalic end. One node will form which is called as Hansen's node. So there is a formation of Hansen's node which is at the cephalic end of the primitive streak. And as you see, there will be a primitive groove also. So this is the primitive groove, and that there will be a primitive pit as well. So there is a primitive streak having a primitive groove and a primitive pit. Now, as you have mentioned all these details, what you have to mention is that towards the caudal end is a membrane which is called as the cloacal membrane. And what is towards the cephalic end? That is the buccopharyngeal membrane. And what about the speciality of this buccopharyngeal membrane, or maybe the cloacal membrane? The buccopharyngeal membrane towards the cephalic end, or the cloacal membrane which is towards the caudal end, they have no mesoderm. Why they have no mesoderm? Because there is a fusion of the upper dorsal ectoderm with the lower ventral endoderm. So, fusion of ectoderm and endoderm with no intervening mesoderm. But who is forming this endoderm, ectoderm, mesoderm? These epiblast cell. And how they were forming? Actually, they are on the dorsal side. They move inside the primitive groove and go ventral. When they go ventral, then they form the endoderm. And same epiblast, they also form the mesoderm, and then they will also form the ectoderm. So, actually at the buccopharyngeal membrane, there is a fusion of dorsal ectoderm and the ventral endoderm. The same happens at the cloacal membrane. We will discuss that again. At this moment, what I want you to understand is formation of the ectoderm. So, what is the epiblast forming here is ectoderm, and we want some details of that. In fact, this diagram now, you will find that this is the region of the cloacal membrane, that is the region of the buccopharyngeal membrane, and more dorsal will be the ectoderm which is formed by epiblast. More ventral, this yellow color is going to be the endoderm, and in between the two will be some mesoderm. But at the buccopharyngeal membrane or the cloacal membrane, there is a fusion of the ectoderm and endoderm. What is happening to ectoderm? Ectoderm is now being divided into certain components like near the midline it is called neural plate ectoderm, and more at periphery. At the margin you will see some neural crest cell, and still more at periphery, that will be the placode, ectodermal placodes formed. And what is still more at the periphery? That will be the surface ectoderm. So, most peripheral is surface ectoderm, then what is most medial near the midline? That is the neural plate ectoderm. And what is in between? This is what we want to discuss now by looking at a diagram. And what diagram is that? That is a longitudinal section. So, you have taken a longitudinal section of the embryo and discussing the same detail once again. Actually, what you find is there is a dorsal amniotic cavity and there is a ventral yolk sac cavity. So, at the floor of the amniotic cavity is the ectoderm developing from the epiblast. And then what will be this? This will be mesoderm developing from epiblast. And what will be this? This will be the endoderm, which is at the roof of the yolk sac cavity. So, endoderm will be at the roof of the yolk sac cavity. One more thing which we have discussed is that there are two membranes towards the cephalic end of the baby and towards the caudal end of the baby. And what is their speciality? If you are talking about buccopharyngeal membrane, which is towards the cephalic end of the baby, there is a fusion of ectoderm, endoderm, and same thing happens to the cloacal membrane also, fusion of endoderm, ectoderm. They do not have any mesoderm, one of the AIMS question in fact. And what is this structure which is between the two? That is called as the notochord. And how the notochord is formed? By the mesoderm, of course. So, epiblast would have formed the notochord, but before the notochord has formed, there will be some mesoderm here. So, epiblast will form the mesoderm, will form the notochord, and this notochord is important because it is going to stimulate the upper ectoderm, and when it is stimulating the overlying ectoderm, that will change into neuroectoderm. This is what we want to discuss then. The notochord is important to stimulate the overlying ectoderm so that it will become neuroectoderm and form the nervous system. For that purpose, let us take a transverse section once again. So, we are taking a transverse section of the embryo, and what do you want to see? The diagram which we already have mentioned. In a transverse section of the embryo, what we want to discuss is formation of some tubes, basically this time the neural tube. So, let us look at that. You see, this is the dorsal ectoderm which will have a neural plate forming a neural groove, forming a neural tube. This is the discussion. Though we will also talk about mesoderm, endoderm, but our focus will remain on the ectoderm. So let's do it. In fact, when you are drawing this diagram, which is a transverse section of the embryo, the most dorsal you are showing is ectoderm. And what is below that? That will be the mesoderm. And what is still ventral? That is the endoderm. Now, what happens is there is a notochord. And what is notochord about? Notochord is actually the axial mesoderm. Now, if you say notochord is the axial mesoderm, what is it important for? This notochord is going to stimulate the overlying ectoderm so that the overlying ectoderm will change into neuroectoderm. Now, if you say this is going to become the neuroectoderm, which is in the central region, then what is developing in the peripheral region? In the peripheral region, actually we have the surface ectoderm, not only on the right side, but also on the left side. So, when you are looking at the periphery, maybe this side or maybe that side, that will be surface ectoderm. Now, if you are telling that this is going to be the surface ectoderm, fine, that is the surface ectoderm. What was that which is developing at the margin? Means between the neuroectoderm and surface ectoderm, what was that? Actually, that will be the neural crest cell. Now, when you are talking about the neural crest cells, you have to understand, in the beginning, we used to believe that neural crest cells would have come from the neuroectoderm, but recently it has been realized that they are the fourth germ layer. If you say neural crest cells are the fourth germ layer, then where would they have come from if not the neuroectoderm? Then they would have come from the epiblast. So, it is epiblast which is forming the fourth germ layer, which is the neural crest cell. What are they doing? The neural crest cells are actually supposed to contribute the peripheral nervous system. Now, if the neural crest cells are contributing to peripheral nervous system, then who is contributing to central nervous system? That is the neural ectoderm here. Actually, one plate will develop. And what is the name of that plate? That plate is called as neural plate ectoderm. And what is the neural plate ectoderm doing? Neural plate ectoderm will form the neural tube. And what is the neural tube forming? It will form the CNS. And what do you include in the CNS then? That is the brain and the spinal cord. Now, if you say that includes brain and spinal cord, then what about the ganglia? If the brain and spinal cord is central nervous system, what about the ganglia? That is peripheral nervous system. So, do you mean to say that ganglia are contributed by neural crest cells? Yeah, most of the time. Most of the time, the neural crest cells are responsible to contribute to the ganglia in the peripheral nervous system. But these neural crest cells not only contribute to the ganglia, they have many contributions in the body. Like what? Like I'll tell you. Neural crest cells can also contribute to what is called as secondary mesenchyme. And what about this secondary mesenchyme? Is there a primary mesenchyme also? Yes. In fact, this middle layer, which is the mesoderm, is the one which is going to form primary mesenchyme. The concept is that most of the books will say this is mesoderm, but Gray's Anatomy says this is the middle layer and it should be called as mesoblast. So, this mesoderm is actually called as mesoblast by Gray's Anatomy. So, what is this mesoblast supposed to do? That mesoblast or the middle layer is supposed to form the primary mesenchyme. Now, if it is forming the primary mesenchyme, then who is forming the secondary mesenchyme? That we have seen is from the neural crest cell. So, neural crest cell contribute to secondary mesenchyme and the middle layer mesoblast is contributing to primary mesenchyme. Now, what are the other details? So, you understand most of the body is primary mesenchyme, but in the head and neck region, it is mostly secondary mesenchyme. In fact, the secondary mesenchyme is restricted towards the head and neck region. You mean to say that in the head and neck mesoderm, it is chief contribution from the neural crest cell? Yes, especially the anterior and lateral region. Now, if you are telling that in the body, anterior lateral region on the head and neck is from the neural crest cell, what about the posterior side? That will be primary mesoderm. So posteriorly it is the primary mesoderm, like occipital bone is from the primary mesoderm, but the facial skeleton and what about the mandible bone also? Mandible bone is U-shaped bone, it is anterior and lateral. So all this would have come from the neural crest cell. That is the point here. So what you are mentioning is that neural crest cell is restricted chiefly to the head neck region, forming some mesoderm. Yeah, but it does not mean that it cannot move throughout the body. It actually moves throughout the body, though it is mostly restricted anterolateral region of the head neck region, forming some structures. Like what structure it is forming? The neural crest cell. Let me tell you what structures it is forming. It is going to contribute to, yes, it is going to contribute to most of the skull bones. So most of the skull bones are contributed by neural crest cells. Yeah, that's correct. Most of the skull bones. So most of the skull bones are contributed by the neural crest cells, right. Also remember that in the eyeball, most of the mesoderm is from the neural crest cell. In the eyeball, most of the mesoderm is from the neural crest cell. It is basically secondary mesoderm and very little primary mesoderm. And what about the other contribution? It is pharyngeal arches. When you are talking about the pharyngeal arches, you will find that the pharyngeal arches are also having some mesoderm, and it is mostly the secondary mesoderm. So what are the exceptions then? I told you already, most of the skull bones are from the secondary mesoderm, from the neural crest cell, but not the posterior portion, like the occipital bone. Why? Where the occipital bone would have come from? From the primary mesoderm. Similarly, if you are talking about the eyeball is chiefly mesoderm, which is secondary mesoderm, and understand from neural crest cell, it has very little primary mesoderm. What about the pharyngeal arches then? If you are talking about the pharyngeal arches, understand pharyngeal arches. If you are talking about the bones like mandible bone, hyoid bone, then that would have come from the neural crest cells. So neural crest cell will form secondary mesoderm, will form pharyngeal arch bones like mandible bone and the hyoid bone, but they are not going to form the muscles. Like which muscles? Like pharyngeal arch muscles. Then who will form the pharyngeal arch muscles? That is from the primary mesoderm. Let us look at some diagrams to understand the detail. And as you want to see the diagrams, you will find that here we are having the diagram. This diagram is telling us ganglia. Maybe it is the cranial nerve ganglia, maybe it is the pre-aortic, para-aortic ganglia, maybe it is dorsal root ganglion, sympathetic ganglia, or may it be even the adrenal medulla. This is all from neural crest cell. Actually, peripheral nervous system, the ganglia are from neural crest cell, even including the anterior ganglia. What is anterior ganglia? You know, it could be a myenteric ganglia, that is the Auerbach's, or it could be Meissner's ganglia, Auerbach's ganglia, Meissner ganglia. Actually, the Auerbach's ganglia will be myenteric plexus, and what about the Meissner's? Meissner's will be in the submucosa. So like that, you have some ganglia, but they all came from the neural crest cell. And what about the eyeball? Eyeball is having some mesoderm, and that mesoderm is mostly from the neural crest cell. It is neural crest cell derived mesoderm which is contributing to eyeball. Primary mesoderm is very little. What about the skull bones? As we have discussed, anterolateral component of the skull bones is from the neural crest cell, but not the posterior, like the occipital bone. Why? Where is posterior occipital bone from? Primary mesoderm. And what else is from the neural crest cell? There is something called aorta pulmonary septum. So aorta pulmonary septum is also from the neural crest cell. Neural crest cell are forming the pharyngeal arch bones, like which one? The malleus, incus, stapes, mandible bone, hyoid bone. So malleus, incus, stapes or mandible, hyoid bone, they all develop in pharyngeal arches, and they would have come from neural crest cell. Neural crest cell will also form the dermis of the head and neck region. I mentioned neural crest cells are restricted basically towards the head neck region. It is also forming the teeth. How? By forming odontoblast. And what is odontoblast forming? The dentine of the teeth. So dentine of the teeth which come from odontoblast would have come from neural crest cell. That is the point here. So let us continue with the diagram which we were having here. In fact, and we have mentioned that neural crest cell would have formed most of the skull bones except that posterior bones like occipital, most of the eyeball and pharyngeal arch muscles are not developing here, only bones are developing. Then what about the muscle? Who is forming the muscle? Muscle would have come from primary mesoderm. What else neural crest cells forming? It is forming the episeptum. What about the episeptum? That is the aorta pulmonary septum. Now remember, aorta pulmonary septum which develop from the secondary mesoderm from the neural crest cell can have problems. Problems in which case, if you are talking about the D-George syndrome. So when we are talking about the D-George syndrome, what is wrong? In D-George syndrome, there is a failure of the migration of the neural crest cell towards the head and neck region. So when you are talking about the D-George syndrome, there is failure of migration of the neural crest cell towards the head and neck region. So the babies will have skull defects, they'll have eyeball defect, they'll have pharyngeal arch bone defect like they have small mandible hyponathia. And what about the episeptum anomalies? Actually, episeptum anomalies are seen in the D-George syndrome, and the most common cause of death in D-George syndrome is episeptum anomalies, cardiovascular defect. Most of the cases of D-George syndrome, they die because of defect in the cardiovascular system, episeptum anomalies. Now, this is one thing which we wanted to discuss. What is the next thing? As we are talking about the next thing, you'll find that we are talking about the surface ectoderm. It was a transverse section of the embryo and showing the 3 germ layers. And which one were you focusing upon? The ectoderm. Now, when you say we are focusing upon the ectoderm, we also mentioned that there will be a central region which is called as the neural plate ectoderm. There will be a central region which is called as the neural plate ectoderm. And what was at the periphery? At the periphery, we were having actually the surface ectoderm. We want to know what is this surface ectoderm doing now. Actually, as the name is suggesting, the surface ectoderm is supposed to form surface epithelium. Surface epithelium. Now, if you say it is forming surface epithelium, not only epithelium but also the related glands. So, basically we are talking about skin here. If you are talking about skin epithelium, which is called epidermis, skin glands which could be sweat gland, sebaceous gland. So, when we are talking about sweat gland or sebaceous gland which are present in the skin, where would they have come from? Surface ectoderm. So, there is some surface ectoderm on the right side and left side, and which is going to contribute the surface epithelium, surface gland like the skin epidermis and the skin glands. These glands, they have some smooth muscles to squeeze the secretions out, and the name of those smooth muscles, they are called as myoepitheliocytes. And what about the myoepitheliocytes? Myoepitheliocytes are some smooth muscle cells which are going to squeeze the secretion out of the sweat and sebaceous gland. And strangely enough, they also come from surface ectoderm. Why? What is strange about that? Because muscles generally come from mesoderm. So, myoepitheliocytes are smooth muscles coming from surface ectoderm, which is strange enough because muscles generally come from mesoderm. But there are some muscles which can come from ectoderm. Do you know any more muscles which come from ectoderm? Yes, the iris muscles. Now, when you are talking about the iris muscles, remember that could be, the sphincter pupillae, dilator pupillae. The iris muscles, the sphincter and dilator pupillae are smooth muscles. And where do you expect muscles from? Must be mesoderm, but no. The sphincter and dilator pupillae come from this plate, neural plate ectoderm. The neural plate ectoderm, the one which was forming central nervous system, yes, is also forming muscles of iris. Yeah, that is what. So, sphincter pupillae, dilator pupillae, a strange finding that muscles coming from neural plate ectoderm. If you remember earlier, we have discussed some rule for surface ectoderm. You remember? The rule of surface ectoderm. Any external opening in our body is lined by? Any external opening in our body is lined by the surface ectoderm. Like what? Like oral cavity. Now, in the oral cavity, you have a rat case pouch, and that rat case pouch will form the most of the component of pituitary, but not the neurohypophysis. You remember that? So, any external opening could be the oral opening. And when you are talking about the oral opening, what was there in the roof of oral cavity? There was rat case pouch. And what was the rat case pouch forming? Most of the pituitary. But it will not contribute to neurohypophysis, because neurohypophysis would come from neural plate ectoderm. So, it is the neural plate ectoderm which will form the central nervous system, it will form the brain, it will form the diencephalon, and that diencephalon would have given a prolongation downward, and that is called as neurohypophysis or the posterior pituitary. So, neurohypophysis or the posterior pituitary is a downward extension of the diencephalon, which is a part of the brain, would have come from neural plate ectoderm. Actually, pituitary is contributed by both the ectoderm, mostly from the surface ectoderm, pars anterior, pars tuberalis, pars intermedia. But if you say pars nervosa, then it will come from the diencephalon or neural plate ectoderm. You know, in the oral cavity, there are some glands, salivary glands. Those salivary glands also come from surface ectoderm. So, we just want to know what is all coming from surface ectoderm, what is coming from neural plate ectoderm. Surface ectoderm will also give you some glands in the mouth, and they are the salivary glands. Let us see some diagram for that. You see, there is the parotid salivary gland, and then under the mandible you have some mandible salivary gland, and under the tongue we have sublingual salivary gland. And where they come from? All the three come from the surface ectoderm. And where is that surface ectoderm? That surface ectoderm which is lining the oral cavity. Now, some of the students might find a problem here, because there are books which will tell that these two glands are basically from endoderm. There are some books which will tell that these two glands are from endoderm. In the early years, long back, we used to teach that sublingual submandibular glands develop from endoderm, but recently it has been found, if you read the recent literature, all these salivary glands are from the surface ectoderm, which is lining any external opening, could be the oral cavity. So, all of them are actually from surface ectoderm. This is some recent information. Okay, can you answer this question? One of the AIMS question. What is it asking? Accept. So, ectoderm, yes, right. I think this is the epidermis here. Yes, skin epithelium, right. So, skin epithelium, where it would have come from? Where is the parotid gland coming from? Both of them would have come from surface ectoderm. And what about the neurohypophysis? Neurohypophysis would have come from the neural plate ectoderm. So, we have already come to the conclusion. The answer should be erector pylorum. But why erector pylorum? It's a smooth muscle in the skin, and just now you told that smooth muscle in the skin is from the surface ectoderm. No, that was not erector pylorum. That was myoepitheliocytes. So, myoepitheliocytes are from the surface ectoderm, not the erector pylorum. Then where is erector pylorum from? Erector pylorum, which is also a smooth muscle in the skin, but it is from the mesenchyme. It is from the mesenchyme. And if you say it is from the mesenchyme, means it is not from the ectoderm? No. So, that is the answer? Yes. Erector pylorum is the answer here.